So we're going to talk about hormones and how getting our hormones into a right flow will actually increase our energy, our overall well-being, and help us really perform and live a happier life for the next few decades of our lives that we have ahead of us. And a lot of times when we're talking about hormones, as I mentioned, reproductive hormones in women, estrogen and progesterone are the ones that first come to mind. And of course, there are so many different changes in our lifetime that we go through with our reproductive hormones. But what we don't really hear about is the interconnection of all of the other hormones in our body, that they very significantly affect our estrogen, progesterone, testosterone, and HEA. So I do have in the first slide, just for estrogen and progesterone, just showing you how these hormones change throughout our lives. From the very early life, as we go through puberty, the changes in hormones as we start increasing hormones to get into our reproductive years, it takes us about 10 years basically for our brain to really get in line and get adjusted to the increased hormones. That's why we see teenagers, they do have these mood swings and their physical appearance changes, the metabolism change, and that is something that is kind of expected. We say, well, they're going through puberty. And then as we go through our reproductive years, our hormones get into more of a higher level, but it's not to say that they're always at the highest point. Still, during those reproductive years, we do have these ebbs and flows of hormones every single month. Hormones usually at the first 2 weeks of our period of cycle, we have estrogen boosting. And estrogen, for the most part, is the hormone of brain energy. We do have more brain energy. We have more drive to do what we want to do. We're more social. All of these things and growth, for the most part, are roles of estrogen. And once we have the ovulation in the middle of the cycle, estrogen starts decreasing and progesterone increase. And that is the hormone of calming. And we sort of don't want to be out anymore as much. We want to rest more. We want to be having more of a downtime, feeling tired a little bit. And at the end of it, we finish one cycle. And getting into perimenopause, because of all of the lifestyle changes that we have, busy lives, a lot of stress that we experience in our daily lives, I see in my practice, women start seeing changes in their hormonal cycle as early as 35 or late 30s. And this is the time that we call perimenopause. These are the years leading to menopause that can take us between 10 to 14 years even. And with the same token that our brain needs to get used to this change and decline in estradiol and in our hormones, during this time, those symptoms are going to start happening. We have symptoms of maybe our cycles are a little bit heavier. Sometimes we miss a cycle. Sometimes we see that they're closer together. We have mood shifts. We have mood swings. We feel tired. And somewhat our sleep is disturbed. And of course, hot flashes and night sweats, that vaginal dryness, these are the things that during perimenopause, as we start seeing these changes happen, these are actually signals for us to know, well, our ovaries are saying, okay, I'm ready to retire. And this is just a matter of when it's going to happen to us.